Being a nurse is about 90% calling and 10% job. Every day we come face to face with life, death, joy, and grief. And over the course of our nursing lives, we never quit learning. Some things we learn only nurses would understand, and some are universal. I will dispense with a little of what we've learned now. You'll go through at least 4 pairs of shoes a year. A comfortable pair is your most important piece of equipment. That and coffee. And wash your hands. I know that sounds obvious, but it bears repeating. Saying you're a nurse and being a nurse are 2 very different things. Your very first medication will be a dose of reality. Your second will be a dose of humility. You will learn to deal with life and death every day, but you'll be helping families who are dealing with it for the first time. Some events are milestones, like seeing your first baby born, or your first code, or the death of a patient. You treat one patient at a time, and you treat them completely and with all your attention, and then you move on. Patients are often in your life for only a short while. You're often in theirs for the rest of it. A warm blanket can make all the difference. So can a cool washcloth. You'll learn to appreciate piggybacking IV fluids. When nobody's looking, dance. You will go from saving a life 1 minute to cleaning up an incontinent patient the next. Life is ironic. Patience will teach you more than you teach them. Check, recheck, then recheck again. There will be a patient now and again who will remind you of why you chose to be a nurse. Embrace those moments. Remember to breathe. In the end, everything you do comes to naught if you don't do one thing. When it's all said and done, you simply have to care.
Imogen King Goal Attainment Theory. Help individuals sustain their health so they can function in their roles by assessing attainment of patients' goals and success of care. Dorothea Orem Self-Care Deficit Theory. A patient's knowledge of future health problems are important for fostering self-care behavior by helping them become independent and accountable for their own care. King's Theory. According to Imogen King, human being has 3 fundamental needs. The need for health information, the need for self-care to prevent illness and maintain health, and the need for care when they are not able to care for themselves. Orem's theory. Primarily the result of her life and work experiences. Human being is the focus of nursing when their healthcare needs exceeds their ability to carry out self-care activities. Goal Attainment Theory. Basic assumption of goal attainment theory is that nurse and client communicate information, set goal mutually, and then act to attain those goals. It's also the basic assumption of nursing process. Each human being perceives the world as a total person in making transactions with individuals and things in environment. Transaction represents a life situation in which perceiver and thing perceived are encountered, in which person enters the situation as an active participant and each is changed in the process of these experiences. Self-care deficit theory. Basic assumption of self-care deficit theory is that people should be self-reliant and responsible for their own care and others in their family needing care. Nursing is a form of action, interaction between two or more persons. Successfully meeting universal and development self-care requisites is an important component of primary care prevention and ill health. A person's knowledge of potential health problems is necessary for promoting self-care behaviors. Self-care and dependent care are behaviors learned within a socio-cultural context. Who is Imogen King? Imogen King was born in 1923 in Iowa. Died in December 24, 2007. She received her Bachelor of Science in Nursing from St. Louis University in 1948, and in 1975 she received her Master's of Science in Nursing from St. Louis University. She got her doctorate degree from Teachers College, Columbia University. Three major concepts of goal attainment theory. First one, concepts of personal system, perception, self-growth, and development, body image, space and time. Concepts of interpersonal systems, interaction, communication, transaction, role, and stress. Concepts of social system, organization, authority, power, status, and decision making.
Seeing patients that I've cared for in the hospital return to a state of health in which they can function. I think that's the greatest satisfaction in nursing.
Who is Dorothea Orem? She was born in 1914 in Baltimore. She died June 22, 2007. She earned her diploma at Providence Hospital in Washington, D.C. In 1939, she received her Bachelor of Science in Nursing from Catholic University of America. In 1945, she received her Master's of Science in Nursing from Catholic University of America. And in 1976, she received Honorary Doctorate of Science degree. She worked as a staff nurse, private duty nurse, nurse educator, and administrator and nurse consultant. Three basic concepts of self-care deficit theory. First concept, theory of self-care, why and how people care for themselves. Theory of healthcare deficit, why people can be helped through nursing. Theory of nursing system, explains the relationship that must be made and maintained for nursing to be realized.
The central idea of the self-care deficit theory of nursing resulted from my exploration of the question, why do people need nursing? And the answer that I became aware of through my explorations is that people require nursing when they are unable to provide for themselves or dependent others the amount and quality of care that is necessary to maintain health and well-being. But these limitations come from the health situation in which the person is or the dependent other is. There have been a number of
Imogen King, Theory of Goal Attainment. Goal attainment theory describes logical sequence of events. Concepts clearly defined. Theory is relatively simple. Assumptions are based on testable hypotheses for research. Dorothea Orem, Self-Care Deficit Theory, provides a comprehensive base to nursing practice, practical in different fields of nursing such as clinical setting, education, research, or administration. Applicable theory for beginner practitioner to advanced clinician. Supports the nursing process by identifying each step. Orem also states that the nursing process involves intellectual and practical phases. Goal attainment. The theory does not focus on family and community. Communication barrier can sometimes cause inability to interpret patients' real perception of the problem, leading to failure in goal attainment. Self-care deficit. Lack of focus on emotional and psychological needs of the patient. Theory is illness-oriented and does not consider the patient as a whole system. Similarities of King and Orem's theories. Both theories believe that patient has a responsibility for their self-care. Both theories view the patient as able to express themselves and participate in their own plan of care. The patient can decide to allow family to be involved in the care. Although each theory is different, the basic understanding that the health of the patient comes first is always a priority. The nurse in every theory helps facilitate procedures and treatments appropriate to the person's goals and outcomes. Each follows the nursing theory and judgment. Differences of King and Orem's theories. King's theory views of health as internal and external stimuli, while Orem's theory view it as a relationship. King's theory focuses on communication, while Orem's theory focuses on self-care. Goal attainment theory. Help individuals sustain their health so they can function in their roles by assessing attainment of patients' goals and success of care. Self-care deficit theory. A patient's knowledge of future health problems are important for fostering self-care behavior by helping them become independent and accountable for their own care.
There have been a number of positive differences that have impacted our service since we implemented self-care nursing. Nursing care has been more of a focus rather than the traditional medical care focus. Nurses throughout our service have a common language that they speak. The standards of nursing care are consistent throughout our service. We have job descriptions that reflect self-care and also our nursing service philosophy statement.
Excellence in action in the use of nursing theory requires time and effort on the part of clinicians and scholars. Nursing should be viewed as a field of knowledge and a field of practice. This demands that nurses continuously contribute to the formation, the validation, and the organization of nursing knowledge, so that there will be a body of nursing knowledge which is contributory to excellence in nursing practice.
How does King and Orem theories help improve the quality of nursing education? The practical nature of both theories can help nursing educators easily formulate goals in teaching. The nursing education can be focused to improve nursing practice by utilizing the theory of goal attainment by King and theoretical principles of healthcare deficits by Oram in the delivery of healthcare.
I wanted to write a book on curriculum to give information to faculty members, particularly, that there should be some theoretical bases for how and why they develop curriculums. And so the first part deals with the theories and then my own concept of learning, of teaching, and of curriculum, and then a little bit on the role of teacher and the role of student. The second part deals with the use of a conceptual framework. Of course, I used my own, and I developed two hypothetical curriculums, one for an ADN program and one for a baccalaureate program. What I tried to do is to show that you can have the same philosophy of nursing education for the two programs, and you can even have the same conceptual framework. But then I tried to show how the content, the substantive content that is taught, and the learning experiences are different. I decided that if I wanted my theory to have any scientific basis to it, I had to review the research literature that was related to the concepts I'd already identified in the framework. So I went to the psychological and sociological literature from which most of the concepts had been derived. And they had volumes of research on all of those concepts. And so I reviewed for 10 years, off and on, the literature, and then developed those concepts on the basis of the research literature, both in nursing and out of nursing.
Impact of King's theory on nursing research. King's theory has been utilized in many nursing research. For example, a study of Vieira, Freitas, Brito, Teofilo, and Silva in 2013 on seniors being cared at home by caregivers using the theory of Imogen King's goal attainment. The focus was to have interaction between the patient and the caregiver to achieve the goals to restore health. By applying King's theory of goal attainment, the study concluded that King's theory was useful in identifying nursing care in the elderly. Impact of Oram's theory on nursing research. Self-care deficit theory has been useful in modern-day nursing research. For instance, it was used in a study in 2009 with patients with heart failure. According to Oram's theory, if education and support was used, it will help in correcting patients' lifestyle and their regulation with the disease. The result of the study showed that by using Oram's self-care model, it shows to be very successful for patients with heart failure. What is health disparities? The specific differences of people with diseases, quality of healthcare, access to healthcare, and health outcome that exist in different racial, social, and economic groups. Factors affecting health disparities. Community factor. A community that is riddled with poverty and violence. Lack of access to healthcare. Can be uninsured or underinsured individual. Personal belief and behaviors. Personal perception of health and disease determines adherence to treatment. Lack of education. Literacy of the individual, community, and race.
I lost my mother and my brother within a year and a half of each other from complications of diabetes.
I have 2 deceased children, a deceased brother. Myself, I'm a breast cancer survivor.
At one point, they denied my mother dialysis because she wasn't able to pay her bills and she didn't have insurance that covered her dialysis.
Every year, thousands of Americans suffer and die needlessly because of racial and ethnic health disparities.
We have cancer. We have asthma. We have all types of deadly things killing our people in this community, in the great United States of America.
Countless studies show people of color often don't receive the same health care as whites, and research confirms overall people of color have more health problems.
We know how to address health disparities and health care disparities in this country. It's within our reach. We can do it.
What will you do?
King's theory on health disparities. Ensure that individuals are involved in the creation of goals for their health utilizing the concepts of personal, interpersonal, cultural, and social systems. Application of Orum's theory on health disparities. The three components of the theory, which are self-care, self-care deficit, and nursing system. Nurses play a vital role by assessing the patient's need and lead them to completion of the inadequacies they have as in healthcare deficits. Physical needs, prevention of hazard, promotion of normalcy, adherence to medical regimen, awareness of management of the disease process are some of the needs that the healthcare provider has to address.